I'm happy that you guys are entering where you're joining us from. Feel free throughout the next part of this presentation. I'm going to be asking maybe some of you guys some questions. So feel free to definitely chat in the chat box, put in some of your responses. Ooh, Long Island, New York. Actually lived in Long Island probably a majority of my life. Made the move to Chicago just a few years ago. So. All right, so for those of you who just joined us, we were just putting in the chat box where you're tuning in from. Looks like we're a few minutes after the hour. I think we'll probably get started soon. I think that's all right, Grace. We're gonna also wait for a few more minutes. All right, sounds good. So we'll get started, and as people join on, we'll welcome them, and you guys get to know a little bit about me in today's presentation. So on behalf of the Association of Schools and Colleges of Optometry, my name is Dr. John Gialousakis. A lot of people do call me Dr. G, where I'm from. And what I'm here today to talk with you guys is all about optometry. I know now that you guys are in high school and some of you are about to graduate, you're looking into some of your undergrads, if you're gonna enroll, if you're gonna take a break year, you know, with this pandemic, things are kind of up in the air, but some of you, I'm assuming, since you're joining us, have an interest in the healthcare fields. So I just wanted to give you a little introduction about myself, and then we'll kind of dive right into the field of optometry. So here I am. You can see my picture. I'm live. And I am an optometrist. I'm actually a residency trained optometrist. I was in your shoes. Let's see, graduating high school. I graduated about 15 years ago now. And I knew probably in high school that I was interested in the healthcare field, but I wasn't quite sure exactly what that was going to be. So I am originally from New York. I was born there, and then I actually was raised though. So I got my elementary, middle school, high school years down in Florida. I was over in Clearwater. And after I graduated from high school, I went back to New York, and that's where I enrolled for my undergrad. And during my time there, that's when I started shadowing different professions. And I myself have had eye issues, nothing terrible, but needing glasses and wearing contact lenses since I was in the 6th grade. So to me, the eyes were definitely something familiar. However, I didn't know if I was going to be interested in doing more the medical side of it, or if I wanted to do as like surgeries, or if I wanted to do more of the primary care and some of the other items that an optometrist would do. So I ended up shadowing various people, and I really enjoyed more thoroughly the optometry side of things. And we'll get into it, kind of the pros and, you know, all the different niches that optometry have that makes it really unique and enjoyable and rewarding. And after undergrad, I ended up taking a gap year, and I started working. I was actually working with different optometrists, and that's when I applied. And so I went to optometry school. We'll talk about that in a second, how that differs from medical school. And once I finished optometry school, I ended up doing a residency. And I ended up specializing in cornea and contact lenses. So now I'm an optometrist who maybe some of you are thinking, oh, that's the person who tells me which one looks better, one or two, here's your glasses prescription. We do a lot more than just that. We definitely do a lot of medical aspect. And I treat people who have disease irregular corneas, who can't use glasses, who can't use soft contact lenses. I actually custom treat them with gas permeable hard contact lenses, which are custom made, and now they're able to see and function again. And then once I finished my residency, I ended up going straight into academia. So many avenues as an optometrist. And I was working at the optometry school in New York. I was there for a total of 3 to 4 years. And then I made the move over to where I am now, which I am a full-time faculty member at the Midwestern University Chicago College of Optometry. My role there is I'm the chair of admissions. So I speak to a lot of undergraduate students. I do speak to a lot of high school students as well. And my other hat is I'm the director of curriculum development. So this is where I'm going to open up the discussion to you guys. Let's start this off. And I'm going to ask, before we even answer this question on the screen, I mentioned to you that I went into optometry. But one of the things that I wanted to differ or to make sure I wasn't interested in was ophthalmology. So here's my first question to you guys. What is the difference between an optometrist and an ophthalmologist? Feel free to put a few sentences in the chat box. I'm curious to see what you guys are thinking, and we'll kind of clarify this further. But, what is the difference between our professions? What do we really focus on? Does one do more primary care? Does one do more surgical care? What are you guys thinking? And I'm going to open up my chat box as well. So feel free in the chat where you guys list where you're from, kind of put in your thoughts. Anyone want to venture a guess? What's the difference between us? All right, well, I will tell you then. Aha, there we go. An ophthalmologist does the more of the surgical care, and an optometrist does more primary care. Yes, that's a good start. And I would tell you that depending on the state that you're in, things can start to differ. So one person said the correction of vision versus looking at finding if there's underlying disease or surgery needed. That's close as well. I would tell you that an optometrist is almost like the primary care physician, like the PCP, who you go for your annual checkups. Well, you go in for your annual eye exams. Not only do we do the exam, which one looks better, one or two, here's your glasses, here's your contacts, we do a lot more where we look at the overall health, and we could track to see if there's any complications from a systemic disease like diabetes, high blood pressure. Do we see any repercussions inside the eye? So we do manage a lot of diseases as well, but there's some times when somebody gets so far advanced where they need surgery intervention. So once they need that surgical intervention, we then refer out to our colleagues who we work very closely with, our ophthalmologists. And so, some of you guys may have heard of cataracts. The lens inside your eye gets cloudy as we get older. Everyone actually gets cataracts. We need surgery at some point. We refer those out to our ophthalmology friends. So we are kind of more of the primary care, although we do specialize in various aspects of it. And we do have different approaches and different schoolings that come along with it. So as opposed to an ophthalmologist who actually goes through medical school, so after undergrad, they go through 4 years of medical school, and then they do a residency in a specific area of, what do they want to study? So now let's study the eye. That's the ophthalmology residency. So they get a 3-year residency, and then after they're done studying for 3 years, well, what am I going to further specialize in? Then they do fellowships, and you hear another year or two of fellowships in a specific area of the eye. So you can see they have quite some time within their schooling. And then with an optometrist, after their 4 years of undergrad, they go into optometry school, which is also 4 years. But at the end of the 4 years, you can actually enter into practice right away. You don't have to do a residency, but we have this optional residency, which will allow you to further specialize in specific areas. So now my next question to you all is, how many of you have had an eye exam? Just feel free to put yes or no in the chat. How many of you have had an eye exam before? Awesome. I see a lot of yeses. And typically that is the trend. When we see people who have had eye exams, who go to the eye doctor every year, that really piques people's interests. And a lot of you have probably had an eye exam with an optometrist. Maybe you had it with an ophthalmologist if you needed some kind of, surgical care. But what was involved in a comprehensive eye exam? And that's what I want to talk with you guys first, because we do a lot more than just giving the glasses and contact lenses. Not only do we check people's vision and we determine what's called their refractive error. So some of you hear like the shorthand note of like nearsightedness, farsightedness, somebody who has astigmatism. All of these are their refractive errors, which we can give them glasses and contact lenses so now they can see 20/20 again. But we also evaluate their eye teaming skills. Some of you may have had a more in-depth exam of this. Some of you might have had more just screenings, but we see how well the eyes work together as a team. How well do the eyes turn in and out? How well do they focus on a specific target? How well do your eyes track as you're reading across? So we do a lot of evaluations of that system, because if there is a deficiency there, we can actually tackle it with what's called vision therapy. So we actually have a therapy for the eyes, just like we have physical therapy for injured knees or legs or anything like that. And then the last part, which some of you might have had this too, and my next question, you guys can put it in the chat as I read on. How many of you had a dilation where they put those drops in your eyes, it makes your pupil bigger, and now you're seeing fuzzy at near for a few hours? And I see a lot of yeses popping into the chat now. So we do that as optometrists. And not only is it that we just do it just for fun, we're doing it for a purpose to make sure that we don't see any issues in the back of the eye that can happen with time. Some people can be totally asymptomatic and we find something wrong. Other times they have a systemic condition like diabetes. So we need to definitely dilate to make sure we don't see any bleeding in the back of the eye. I'm going to show you guys some fun pictures in a little bit. So a comprehensive exam usually evaluates these three key areas. Now, here's just some fun facts about this, our vision and how it changes. But as we enter into adulthood, and you guys are into this too, even I would say this, adulthood as you're in your high school years too, for sure, there's a wide range of activities in which you need good visual function and eye health. You can need it just to be able to go to school, to be able to see the board, to be able to drive, to be able to participate in sports. There's so many things that, vision is an important sense. And changes in our visual function can affect our ability to perform many of our activities that we do on a daily basis. And it could be as simple as somebody's vision getting so bad that they can no longer cook, they can no longer care for themselves or drive. So there are a lot of repercussions for not having good vision. And since these changes often develop gradually, their effects may not be readily apparent. That's why we recommend these annual eye visits. So these normal changes, and I want to stress that these are normal age-related changes, increases in prevalence and incidence when we have systemic diseases. And so when you have diabetes, when you have high blood pressure, even if you have something that you would not think would be associated with the eyes, like Crohn's disease or inflammatory bowel syndrome, so issues with your GI system and your stomach, some of these have side effects in the eye. And a lot of the times we take medications which have a lot of side effects with our eyes. But obviously as we get older, it definitely is very important. But my next question to you guys is, how old do you think you should be when you get your first eye exam? When do we recommend to get your first eye exam? Feel free to put that in the chat box. We got 2 years, 5 years. Good guesses. Anyone else? Yeah, so everyone's kind of giving me kind of this 2 to 5 range. And we would recommend eye exams during this time, but the first one we actually recommend between the months of 6 and 12 months of age. So we start really early, and you'll be like, how can you do an eye exam on a 6-month-old? It's actually probably some of the easier, faster exams because everything is very objective. We can't ask a 6-month-old, which one looks better, 1 or 2? So what we're doing is using our tools that you would learn in optometry school, like shining a light into the back of the eye and seeing the reflex that comes back engaging what their prescription is without them even having to say anything. So we do these exams to make sure that they're on track for normal eye development. And if not, when do we need to interject and maybe give them a glasses prescription? So if you ever see, you probably maybe have seen cute videos, maybe, a 12-month-old getting the first pair of glasses. It is something that not all optometrists would do. Maybe they don't feel comfortable working with pediatrics, but it is something that exists, is pediatric eye exams at that young of an age. There's even a program called Infancy that offers free eye exams to those between the months of 6 and 12 months because they know how important it is to get that first eye exam done early. Now, the leading cause of vision impairment and blindness in the US is things like cataracts, which I just talked about before. Have any of you guys heard of glaucoma? I feel like that's like a common one thrown out a lot in like TV shows and movies. So glaucoma, which is a disease of the optic nerve, which is, I'll show you pictures in a little bit, but basically what does glaucoma do? It actually affects your side vision. So people don't realize they have glaucoma. Most people are asymptomatic, no pain, nothing. And until they don't, until they get the eye exam and they're like, ooh, there's some changes going on here, we need to do a workup here. These people can go undetected for many years until it's too late, where they lose a lot of their side vision. And then the last one, which is another common one we hear about, is age-related macular degeneration. Now, this is the opposite. It's not the side vision, it's the central vision. So now, unfortunately, if I'm looking at you guys, if I was to look at, your face would be blurry, but everything around you would be clear. So we have these different items listed here that are the leading causes. Now, diabetes is a big thing and a big concern. And one of the common complications is actually bleeding. And the bleeding from the vessels could happen inside the eye, which could lead to a reduction in vision. So diabetic retinopathy, which just means there's an issue of the retina, the back layer of the eye due to diabetes, is a leading cause of new cases of blindness and low vision among Americans in this large age gap, 20 to 74. So comprehensive eye exams can determine your vision. You all come in there and you hear, ooh, 20/20, right? Now, there are some terms here that you can't throw out and be like, I'm legally blind. How many of you in here would consider yourselves legally blind because you have like a prescription that you feel like you cannot function without your glasses or contact lenses? I hear a lot of people say that. They're like, me, I can't see nothing. But one of the things we have to be careful with that term, because when we as optometrists or ophthalmologists in the eye care field say you're legally blind, that means with your glasses or contact lenses, you can't see a certain amount. So more than 3.5 million Americans over 40 years and older might be either legally blind, which means, you guys are hearing the words 20/20, right? You always think of that gold standard, 20/20. Well, they have vision 2200. That means it's 10 times worse. They can't even see a letter 10 times bigger than that 20/20 line. Or they could have perfect central vision. But remember, glaucoma affects your side vision. If it gets constrained to be 20 degrees or less, you could also be considered legally blind. Because imagine all you could see is just like if you grab, a roll from your toilet paper or your paper towels and you put that to your eyes, that's all you could see. That's not great. Vision impairment just means you have a reduction in vision and it's 20/40 or worse. Typically, if you have that bad of acuity, you might not be able even to drive legally. So don't say next time that you're legally blind, because you actually just might need your glasses or contact lenses to see. But we do know that in the next 30 years, we're going to see a lot of people, especially as they get those baby boomers, they're going to be having a lot of issues. And this is going to lead to a lot of my slides where we're going to say we need more optometrists in the field. So hopefully you guys are here. You might have an interest in the eyes. And I want to show you some cool pictures now. I feel like everyone appreciates some pictures and like oohs and ahs here. But this is what we see when we look in the back of the eye. And in the back of the eye, I'm going to annotate real quick. Let me choose a different color so it can stand out. Right here is the optic nerve. That was the area I was telling you about that we look at really closely for things like glaucoma. That's basically all of the layers in the back of the other retina coming together, and that's what goes to your brain. So you guys may have heard that there's cranial nerves. This is actually cranial nerve number 2. This is the only cranial nerve that we could visualize in the body. The retina is everything else that you see back here. So we do evaluate the retina very closely. Again, we're looking, you can see these blood vessels that are coming out, these arteries and veins, because sometimes we could see leakage coming out of them. And then what we have here is the macula, which is the central part. It looks like a little cherry red spot in the middle. So that darker area, that's our seeing part of the retina. So if I were to look at you, that's the part of the retina that I'm using. All right, so let me kind of clear this off, and we're gonna show you some good looking retinas on the top here. They all look slightly different in coloration. They might all have just different pigment in their eyes, similar as we all have different pigment with our bodies. And you can see here that you have a nice optic nerve, you have a macula, the darker little red area in the middle, and you have the blood vessels coming out of the optic nerve. But this does not look good. I've showed you the left one here, which is normal. This is what diabetes could do in the back of the eye when it's uncontrolled and your blood sugars are high. You get leakage of those arteries and veins. You even get protein leakage. The one all the way to the far right, this was supposed to be the optic nerve, that nice circular structure. In here, it's very blurry. It's actually raised, so it's coming towards you. And there's some bleeding. This, if you especially see this in both eyes, this is a medical emergency. The first thing we need to rule out when we see a swollen optic nerve is potentially a tumor in the brain. So again, us as optometrists, we see so much that could be happening in the body, and we have to refer and work with our colleagues like our primary care physicians, like our endocrinologists, like our neurologists, to make sure the patients get the care that they need. And I'm going to show you some cool things that our students nowadays and a lot of optometries are using to perfect their skills. Virtual reality is a big thing. You hear virtual reality a lot now for different avenues, but we use it definitely in the healthcare field, especially in optometry. We have these different skills, like the one all the way on the left is using a single handpiece to look in the back of the eye. We have the middle picture, which is actually like a headpiece, and actually has viewings out of both eyes. So you can see out of both eyes at the same time, kind of gives you like a 3D view. And we have this instrument all the way on the right, which evaluates the front surface of the eye. You can use it for the back of the eye. But now we have a virtual reality version where students can practice on and also see patients who have, patients being virtual patients, who have these diseases. And they can see them early on in their optometric career before they actually even get to the clinic. Otherwise, what's been happening for most times, all these years, is that you train with your classmates and you evaluate their eyes, and usually they're very healthy. So you don't get to see anything until you got to the clinic. But now with virtual reality, we're seeing that it's making our clinical evaluations much earlier on in the curriculum, and they're getting stronger, being a stronger clinician. So this is just one company that offers that, and you'll see a lot of optometry schools as you do some of your research who offer this technology. Now, this is what you would see with virtual reality. This is what you guys probably have experienced when you got a dilation, you put the drops in, and this is what we're looking at when we go inside the eye with our tools. Again, we're evaluating that optic nerve with the vessels, the arteries and veins coming out, and we're also looking all the way on the far outskirts of the retina to make sure that there's no tears or detachments, and that's only can be detectable with a dilated eye exam. Sometimes people can have issues far out there without having any symptoms. So this is kind of a good little slide that talks about how do doctors of optometry, how do we change lives daily? Well, not only do we just help people and improve their lives, we're obviously protecting their most valued sense, which is vision. We diagnose, we treat, and we manage a lot of diseases. Now, again, when it gets really severe, maybe they need a surgical intervention, do we then refer out to our colleagues or ophthalmologists? My special interest, remember I told you that I work with a lot of people who have diseased corneas, that front surface, which is supposed to be a nice clear dome. They have irregular, they have scarred, and they need a specialty hard contact lenses. But we have optometrists who might focus solely on what's called low vision rehabilitation. So we talked about those people who are legally blind. Maybe we could offer them things that are like telescopes or stand magnifiers, other tools that can help maximize their remaining vision. We have vision therapy for people who need to strengthen their binocular system, working two eyes as a team, focusing or turning in and out together. We also have pediatrics. It's a lot of people are comfortable with children. So when we start to see more and more children, especially at a younger age, which is where, remember, we recommend that first eye exam between 6 and 12 months, and then it happens years after that as well. Now, we also talk about, or you will hear about optometrists who even volunteer provide eye care on mission trips. That's always a big thing, is giving back to our community, not only on a local level, but on an international level. So you'll see people who go to low income areas who are able to offer their services. Now, what is the future for doctors of optometry? And I talked a little bit about this. There's going to be this increasing need. There's going to be about 12 million Americans who are either going to be blind or visually impaired. There's going to be about 7% of children who are going to be diagnosed with an eye or vision condition. You might hear of things like an eye turn, or they have such a difference in the prescription of eyes, they might develop a lazy eye. So you might hear that late term lazy eye. But because of our issues with diabetes and other systemic conditions, they might have eye complications. And then there's going to be people who have just the normal changes like cataracts. So we see from a lot of data that's been collected that the employment for optometrists projected to grow 4% through 2029. Now, remember, we have this growing population who requires good vision, and this aging population needs vision care. You'll see it so much where a lot of states are now advocating for optometrists to do more. So if you go to a state like Oklahoma, they can actually do certain surgical procedures. And that is happening in other states as well. We're on all the plans that ophthalmologists would be on. We bill insurance the same way. And the biggest thing that, and maybe you guys are seeing this, especially during COVID, screen time, right? Everyone's on the computers now. We're seeing a lot more eye issues. When we're on the computer, we don't blink as much. What is that going to do? Well, the blinking actions will releases more tears into our eyes. So if you're not blinking, now you're getting less tears. Now you're going to get more dry eye symptoms. We're also seeing associations of near work with perhaps an increase in near prescription. And someone's prescription keeps going up every year. It could be maybe due to all of the work that they're doing up close. What's nice though is you also see these best job reports, and optometry is always in there. You'll see like around the top 20. Not only is it best healthcare jobs, but also good paying jobs too. So we have a lot of different career paths. I'm talking to you as an optometrist who's in academia. So I am now at a school of optometry where I teach future optometry students. But an optometrist can go into a private practice. They're gonna want to just open that up, have their own, clientele and work with them in the community. Maybe they'll do that with a partner. Maybe they're gonna open up a group practice as multiple specialties. But you also see it where optometrists enter into a hospital-based setting like the VA, Veterans Affairs, or a military base. So you're going to offer your services for a different type of population. So you could see that there's a lot of different environments in which an optometrist can fit in. Now, the average net income for optometry, according to a 2018 survey, was about $140,000. That's not bad. All right. And when you think of kind of our, work-life balance, that's something that's usually appealing for a lot of people because, again, if you kind of compare us to ophthalmology, when you go through med school and then you enter into your residencies and think about being on call and working around the clock, a lot of optometrists, what do? If they're in a private practice or anything like that, they kind of work a 9-to-5 job, Monday through Friday. They have time for their families, starting a family, and it's pretty good rewarding financially. This is something that I love, and this is like me putting on my director of curriculum hat. I love bringing in new technology to, show our students and to train them on, but you always see that on the clinical side too. There's something always new coming out. I talked to you guys about virtual reality just from like an educational perspective, but from a clinical perspective, there's technology now that we do in the form of like eye drops and contact lenses to actually reduce your prescription. So some of you might be like shaking your head, this happened to you. Your prescription kind of going up every year. Well, we could do something to help slow that down. But you'll also see kind of like the telescopes and new procedures that could actually help with drops and drug delivery in the eye, or contact lenses that you put on not only just to see well, but that actually measure your eye pressure or measure your blood sugar levels. So it's really cool things that are working. And I feel like every year there's something new that comes out. So I'm calling you guys from Illinois. We have 2 optometry schools here, but as you can see here, we have 23 schools of optometry kind of coast to coast. So if this is something that you're still interested in after today and you want to do some more research, you go to the ASCO website. You can definitely click on more and kind of talk about and see what each school's requirements are. But my goal today is to talk to you guys a little bit about that. So what do you need to do now as a high school student? So if you're interested now and you know it, and I've heard of these cases a lot where people know from high school for sure, even if you're not, I would say start with shadowing. I know it's hard now during COVID, but when the time calls for it again, ask your doctor of optometrist to, can I come shadow you in your clinic for a few hours? If you really want to get a head start and they don't want to bring you into the office, even if you just do informational interviews, let me talk to you more and pick your brain and see what it's like to be in this practice. What was your path to optometry like? But once you fulfill that and you're like, okay, I think I really do like this field, you're going to be entering your undergraduate studies, and somebody's going to be like, well, what do I need to major in? And the answer is you can major in anything you want to. Most schools just usually require completion of degree, but there are some caveats to that. But you can major in anything you want. I majored in mathematics. What am I going to do with my math degree now? I'm not sure. But I really enjoyed math when I was a student in high school, and I continued that throughout undergrad. So you can major in anything you want. The only thing is you have to complete certain prerequisite courses. So I gave you a selection here on the side that you can kind of see. Some of you might have already had a head start. Maybe you've taken AP classes, advanced placement. I did that. I took AP chemistry. I scored well on the AP exam. My undergrad accepted that, and I tested out and got credit for a full year's worth of general chemistry in their labs. So if you are not a senior, maybe you're a freshman or sophomore and you're like, ooh, I'm going to be registering for classes, think about taking AP classes. Those are very rewarding in the end, and they help save you financially later on. The other option is if you're dual enrolled. So sometimes you have the option as a high schooler to go to a local college and take classes there. That's another option to kind of knock some of these prerequisites earlier. But as you see, some of these might be more higher level, and one might be something that you need to complete before you take another class. So this is a typical kind of layout here of the classes you need for optometry school. Now, I talked a little bit about being dual enrolled as a high school student. However, you might want to do your research and see if there are certain optometry schools which offer dual enrollment or dual acceptance. And what this means is, if you start with dual enrollment, is that there are actually some optometry schools who have joint affiliations with undergraduate institutions, where let's say you complete 3 years of study towards your 4-year degree, you successfully complete certain requirements like those prerequisites on the other slide, and if you have a certain GPA, you can actually enroll in optometry school. So you finish 3 years of your undergrad, you go straight into optometry school, and at the end of your year 1 of optometry school, if all is successful, then you also get your bachelor's degree. So kind of dual counts your 1 year of study, your first year of optometry school towards your last year of undergrad. So that's called dual enrollment. So you can look into some of these programs, and you might see them listed as what's called a 3-4 program. So 3 years undergrad, 4 years optometry school. The other program you might see is something called dual acceptance. So you're never really dual enrolled at any given time, but there are some optometry schools who have joint affiliations with undergrads where after you obtain your bachelor's degree, so that means you finished your 4-year degree, maybe you finished it earlier because you had a lot of AP credit or dual credit. So whenever you get your degree, if you meet certain criteria, so it's usually you finish your prerequisites, you got your GPA at a certain level, you just get automatic acceptance into optometry school without having to file an application or do any standardized exams. So that's another great option. Both of these, I would say, are financially rewarding as well. So what is the Doctor of Optometry curriculum like? So again, now you're done with undergrad, you're in this graduate program. Well, in your first years, you're taking more of those basic science classes again, but they're definitely geared towards optometry and learning your skills to be a good optometrist. As you get into your third year, it's typically when you get more hands-on patient care while you're completing your academic requirements. But that last year, the 4th year of optometry school, is where you do your externships and internships. So that's where you're just spending all of your time, maybe rotating across the country, completing externships. So you're getting to see what it's like to be an optometrist in a specific state and what it's like to be at a private practice versus a hospital. So it's all very clinical. And again, residency is that optional 1-year residency that you can complete after your optometry school. And some people, I would think the latest fact that I saw was about 27% of 4th year optometry students go and participate into a residency. So less than a third, but it's definitely something rewarding. And you're always like, why would I want to do a residency then? Well, let's say you want to work in academia, like what I'm doing. If you want to give back, if you want to work with certain ophthalmologists, if you want to work in certain hospital settings, some of them require a residency. So we have a lot of different paths. And why is optometry such a desired profession? Well, we get a good work-life balance. We are caregivers that definitely make a real difference. And as I keep on talking about, and you guys know how important this is, vision is one of our most valued senses. Now, there's also a little slide here that talks about various areas to learn more. And I would say you can start off by shadowing. Contact your local optometrist. Maybe you want to contact one of the schools to get any more information about finding an optometrist, and see if this is something that you are really passionate about and really enjoy. The American Schools and College of Optometry have information and that include videos and blogs and application information on their website. Optomcast, which is a centralized server. So let's say you're ready to apply to optometry school, you would actually fill out an application through this server and you put in all the information and it goes through all the schools that you want to apply to. But we also have other groups that are really geared towards practicing optometrists, but they do a lot of events for optometry students and those who are interested in optometry. So those are the American Optometric Associations and the American Academy of Optometry. Now, this is my last piece of advice, and then I want to obviously open it up to you guys with more questions. But start now in high school by looking at AP credits and dual enrollment credits when possible, because you can get a head start at tackling that undergraduate degree. And this is something that could be very cost effective later on. Somebody also would ask, can I start at a community college and then transfer over to like a university? And I would say absolutely. Sometimes that could be cost effective. Sometimes you're not sure where you want to go in your path. So starting at a community college is not a bad idea. It's something that I would recommend to some people. But if you want to start with the university right away, absolutely, you can apply there. Oops, didn't mean to go back so far. Dual enrollment is when you are, again, enrolled in high school, but you're able to take classes at a local, college nearby. Shadowing, get that time in. And I would say shadow multiple doctors of optometry. Shadow that doctor who might be in an optical setting, who maybe is geared towards glasses and contacts. Then shadow an optometrist who has a private practice. then shadow an optometrist maybe in a hospital setting. So you can get really an idea of the various roles that we hold, and also shadow different specialties. So, pediatrics, vision therapy, low vision, all these different ones. You're going to want to start thinking about letters of recommendation, because throughout your undergrad, you're going to need those to apply to optometry school. Sometimes if you're going to be looking into a 3-4 program or a dual acceptance program, you might need those letters early on, even as a high school senior applying. So who are those good letters? Get those letters from people that you worked with closely, that know you. So especially in undergrad, where you have a big class and maybe you're like, a little person, in this big room of 300 people, sometimes the instructor doesn't get to know you that well. Make time to go to their office hours. Make yourself present and asking good questions. And sometimes when you get in those lab settings where it's smaller groups, they really get to see you shine. So those are the better people to ask for letters of recommendation. Don't ask those people who have never met you, but you got a good grade, so you figure I'm going to ask them for a letter. It's not going to show any more difference. We're not going to see anything from that letter other than what we already saw in your transcript. And something that you'll do in your research for optometry is that it is mostly rolling admissions. What that means is that usually July 1, applications open up, and then we interview throughout the whole year before we start the cohort that following August, September. The sooner you get your application in, the greater the chances you have for getting an acceptance and an offer to that school. Imagine applying in August when it opened up recent, compared to applying to in April, months later. There are less spots available, since when you're on a rolling admissions, that means you offer acceptances until your class is filled. And then standardized exams. So a lot of people here have heard of medical school, right? Becoming a PCP, a physician. People have heard of the MCAT. That's like the big thing out there, right? That's a test to get into medical school. Well, there is another exam for optometry school. It's called the Optometry Admissions Test, the OAT. So that is something that some schools are starting to even not require, but I would say the majority of schools still require some form of a standardized exam, and most likely it's going to be the OAT. You're going to want to study for that as you enter into your last few years of optometry school. So it's typically after like your junior year, so that you can prepare. This is an exam that tests all your sciences, your biologies, your chemistries. Remember those prerequisite courses? Kind of gives you a snapshot knowledge of what you kind of retain and what you know entering into optometry school. So you want to aim for 50th percentile or better scores on these standardized exams. So this is where I'm going to open it up to you guys now. And I hope that I was able to answer some of the questions that you might have had on your mind, or provided you of information that you haven't heard of before. I know somebody in the chat asked if they were able to access the talk afterwards. And yes, the webinar recording will be available to view on the website. So any questions that you guys have at the moment that's lingering on, as a, it could be anything from, what I do as an optometrist to the whole process of becoming an optometrist, or anything that you think of now as a high school student. And if you don't have any of those questions at the moment, I have my information up on the screen. You could always feel free to reach out. Just be like, hi, my name is so-and-so. I attended your talk. I have, this question, and I would be more than happy to help you with that. So a question came up of saying, so you have to go to optometry school for 4 years after finishing 4 years of undergrad. And the answer to that is, after you finish your undergrad, if you finish it in 4 years, maybe you finish it earlier. So yeah, once you get your degree, you then can apply for optometry school. You can even apply before you finish your degree. You just have to finish your degree before you actually matriculate into optometry school. So we typically see a lot of people who are in their last year. They're taking a few classes left, and then they're still applying. So yes, optometry school is 4 years. That can't really be expedited. Although we are seeing now some schools of optometry who are doing kind of like a 3-year program where it is kind of expedited and it's going through every summer, starting earlier. But most schools are 4 years. Somebody said, why did I choose optometry? I grew up myself being in the eye doctor. I had glasses and contacts when I was in 6th grade. And to me, it was something comforting. I really enjoyed going to the optometrist. I feel like I got to talk to them. They got to listen to me. It wasn't like one of those appointments where you just went in and you were just a name to a paper and they did whatever you needed to do and they went to the next person. And so when I started shadowing, I got to see those relationships again. And I got to see how, all the specialties existed. I got to see vision therapy. I got to see contact lenses, advanced contact lenses. And I was like, wow, this is really fascinating. I really enjoy everything that optometrists can do. What happens if a person's eye is red sometimes? So this is getting really to like a medical question here. But basically, in a nutshell, a red eye could be so many things. And I would say, I get my colleagues, I get friends and family who send me pictures of their eyes. And I'm like, oh, okay, this is going to be hard because you really need the tools to evaluate the different layers and to see where it's affecting. Is it more viral? Is it more bacterial? Do we need to treat it with medications? Do we need to treat it topical medications, eye drops, or do I have to give them oral medications? So sometimes it could just be red because it's dry. Sometimes it could be red because it's infected. And so I'm sorry, I can't really answer that into depth because it's such a really big area. Red eye, there's like a whole class that can be given on a red eye. Is it possible to go to optometry school in another country like Canada? And yes, so we have, I would say a lot of students from Canada can come to us in the States, and then they end up going back to their home country to practice. But there is a school in Canada, which I know there are some US students who would go there. I would say that the big thing is that once you're in optometry school, you have to fulfill your board exams. So come 3rd and 4th year, there's 3 parts to a board, and you just have to make sure that you are passing the US boards so that when you graduate from one of the schools of optometry that's located in Canada, that once you get that Doctor of Optometry degree and you pass your US boards, you can practice again in the United States. Now, it's because of the Doctor of Optometry degree, we do not have the ability at the moment to say, go to optometry school in Great Britain, in London, because their scope is very different. Those do not transfer easily to United States. So currently, it is the United States and Canada. Yeah, of course. How many years? How many years does it take? Um, maybe it's a So as far as the process goes, again, is however many years it takes for you to complete your undergraduate degree. And once you are done with your undergraduate degree, you can enroll in optometry school, which is 4 years. So optometry school is a 4-year program, and then you can practice right away. Once you're done with optometry school, you do not have to do a residency, but some people often do a residency to get more experience. I would also say there are some optometry schools which do not require a degree. There's a few of them. So they might only require 90 credits out of the 120 that are required usually for a typical degree. So they would take you if you have just finished your 90 credits and you finish your prerequisites. However, I know most students like to finish their degree. I'm not, just in case anything were to happen, maybe after their first year of optometry, they find out that it wasn't something that they were interested in anymore. At least they have their degree to fall upon afterwards. So how many years does it take you to be an optometrist? Again, after your undergraduate career, which if that took you for your traditional 4 years, and then optometry school is another 4 years. So it's a total of typically 8 years of schooling. What is a normal day like as an optometrist? So it depends on what avenue you're in. So let's say you're in a private practice, you would start your day off, whatever that time would be like, 8 to 9 a.m. or so. If you have patients scheduled every 30 to 45 minutes, and you would be seeing various patients that might include just a normal comprehensive eye exam. Maybe there's some contact lens fittings, maybe there's some pediatric eye exams, whatever it is that's kind of scattered throughout the day. Maybe you'll get an emergency that comes in, those red eyes that we just talked about, or, flashes and floaters, something's funny going on with my vision. So those always kind of make the day a little bit more interesting. And they always happen. We always have a running joke that they always happen emergencies on a Friday at 5 p.m. But typically, if you're in a private practice, you're kind of just seeing those patients throughout the day. My day as an optometrist is a little bit different because I'm in academia. So not only do I see patients in the clinic with our students who are interns and they are seeing the patients, and then I supervise them, I also teach at the campus, and I teach them different classes, and then I'm in the labs. So it kind of makes my day a little bit more interesting because it's so different every day. What do you enjoy most about optometry or being an optometrist? So I love the fact that I am able to make someone's their vision, right? It's such an important sense. I'm so happy that I'm able to be the one to provide that service, and they get to leave with me, getting to talk to me. We get to know each other. I get to know them really well, and I get to see them on an annual basis and really kind of monitor them and tell them, when I think something's concerning, and I need to refer them, or do we need to manage this? Do we need to do more eye exams? So we get to know each other very personally. And I also love the fact that I get to balance with my outside life. And at the end of the day, I can kind of go home and be with my family. And then I don't typically have those on-call duties that some other medical specialties do. So it is something that I really enjoy, just because it's not like I'm only in the exam room for 5 minutes, and I'm in the exam room with them for about a half hour, and you get to know them really well during that time. Is a job demanding? Like, there are calls that ask you specifically to come see the patient. There could be some avenues. Let's say you're an optometrist working in a hospital-based setting. That could happen. So you might be a type of doctor who is on call and who needs to go in. Otherwise, you might be just someone who just has to triage over the phone. Maybe you just hear their complaint, see if it's emergent, can it wait till the next day? Those are some items that you would have to look into for the different modalities that optometrists can, go into. So can the job be demanding? Yes. Can it be more lax and more balanced? That could be as well. It really depends, and probably every day is a different challenge. How competitive are the schools? Again, I start off by saying how these schools are on a rolling admissions basis. So I would say that it becomes even more competitive later on in the cycle. But I would say every school is very different. So, there could be some schools that are very competitive in the sense of GPA and standardized exam scores. While there could be some schools that are a little bit more holistic in the application process. So maybe they don't weigh that as much, but weigh kind of like communications during the interview and your overall package and what you have to offer. So I would say I can't really answer the question saying that like all schools are competitive or all schools are easy. There's definitely a range. How often do you have a rare case in a patient? I would say that that's what's another thing that's kind of rewarding, is that as an optometrist, you never stop learning. There's always going to be something that's going to stump you. You have to look into it more. You're going to run additional testing. You might get a second opinion, but it happens quite often. Not to make any of you guys kind of like disgusted or to hear anything, but like back to these red eyes. having just like a patient who just routinely comes in thinking they have, pink eye, like a, discharge out of the eye. But then this person also has a weird presentation of it that happened within hours. And when we think about that, sometimes that could be associated with things like sexually transmitted diseases. And now you got to treat a different variety of red eye. So there are these times where something is not common, and you're going to have to do a little research again into how you should better approach this and treat the patients. But I would say that there's always some kind of complexity to cases, usually on a daily basis. I wouldn't say you're always going to go in there and be like, which one looks better, one or two, here's your glasses. There's usually something involved that you have to think a little bit more, especially when we think of systemic diseases and how they affect the eye. Do you have to take your OAT exam before applying to optometry school? So again, that OAT exam is the optometry admissions test. Most schools would require it as part of the application process. So yes, I would suggest that you take the OAT exam before, but here's the big but, is if you are like waiting to take it, like it's scheduled, you could still apply. And maybe the school would offer you an interview, or they might just hold your application, and then they won't make a decision until you submit that OAT exam. So I guess to answer the question at its core, yes, you could apply without the OAT exam. However, you might not be considered for an interview or really considered as a full candidate until that OAT is submitted later on. All right. Any other questions? Okay. Well, if not, again, my email is on the screen. Maybe you think of something later on, but I thoroughly enjoyed talking to all of you. Oh, I got one last one. Did you take the OAT, and if so, how many times? So the OAT, you can take it more than once. You could actually take it up to 3 times. And if you need to take it more, there is some extra rules you could do to take it more than that. But I would say, yes, I did take the OAT. I only took it once. But there are some students who need to take it a second time, maybe to get a better improvement in score. And I would recommend that. And I would say that actually looks good in an application. Let's say you took it once and you weren't happy. You studied differently. You took it again and your score went up. Again, that really stands out, and schools would look into that and find that favorable as well. So look into hopefully only taking it once, really prepare well. If you do not feel prepared, reschedule it until you do feel prepared. And then if you happen, I would also say, do not take it just to see how you're going to do. That is a waste of money. Only take it when you feel like you're ready, prepared for it. Take the practice exams instead. There's other services out there like Kaplan who do like those review exams, and then take the exam. Do we need to do shadowing or research like people do for med schools? And the answer is yes. We do look into that to make sure that you have a known understanding of what an optometrist is and what they do. I would say research is not necessary. However, that could be a plus, but it's not necessary. I would say shadowing is. Can we go to work with bachelor's degree, or you have to complete the optometry school? Can we go to work with a bachelor's, or you have to? I'm thinking is if you want to become an optometrist in the United States, you need to complete optometry school and the board exams, etc. I know there are some countries who have a bachelor's degree in optometry and they work differently, but here in the United States, in order to practice optometry school, you need to have your Doctor of Optometry degree as well as the passage of board scores. All right. So again, my email is here. I hope you guys enjoy the rest of your evenings. I'm happy to see that you have an interest in optometry, and we'll hope to see your applications in the near future. Take care, everyone. Have a good night.